Hi, this is Dick Flanigan of the Cerner Corporation. I'm really pleased to be on the program today. And I thought I would take you through a quick review of who Cerner is and some of the things that we've been doing from a COVID response perspective. I have a variety of responsibilities at Cerner, but I also have the pleasure of co-leading the COVID-19 Enterprise Strategy Task Force. That involves a lot of different things, but essentially I'll take you through some of how we have thought about assisting our clients, how we keep our own business resilient and capable of supporting those clients, and together reimagine the future with our clients. So we're a healthcare IT company. I've got slides to go along with this, so I'm on slide 2 on Cerner today. And for those of you not familiar with Cerner, this is just a little bit of the background on the speeds and feeds. Won't spend a lot of time on this. We're a company that has focused 100% on healthcare. We've primarily been focused on the provider side, so hospital-based organizations, physicians-based organizations. We have relationships with lots of different um, um, types of healthcare companies, but that's been the primary focus. About 27,000, 28,000 associates around the world, primarily in the US and Europe, but we have strong presence in Australia, Canada, the Middle East, and have a large development support team in India as well. So a global company with lots of global concerns and a lot of things that had happened very quickly with the onset of COVID, like I'm sure many of you have been dealing with over the past 3 months or so. So you can see some of the background. I'm going to switch gears and talk about these COVID waves. So one of the things that we have thought a lot about organizationally is what is it our clients are actually seeing? What's the market seeing? So in fact, you have what we would call wave one, and that's this initial surge that's taken place throughout the United States and around the world. And that surge, while we're coming down off of that curve and still have a large number of cases in the United States, and in some markets we have rising hospitalization, we have not, beaten Mother Nature here yet. So we are very much so in the thick of things. We did not peak to a point that we ran out of hospital beds or vents. So that was one of the great things that happened as part of the prediction set and the actual use cases that we saw around the country. But in fact, there are still lots of challenges ahead, particularly staffing challenges and others. But this wave one, as we come down off of wave one, really wave two begins to be what happens to when this disease, when this pandemic starts to crop up in other times and places. And certainly we're seeing that today as some of it's moved further south out of the Northeast and the upper Midwest in some cases, and now into Texas, Arkansas, Arizona, and other states. So lots still happening there. And that's these additional, if you will, kind of echoes of the major wave. We also are concerned that there's going to be a fall resurgence, that will this begin to mirror some of the aspects of the seasonal flu. Now, when you take those waves together, and then you consider that we have a fourth wave, which is really the behavioral health wave. So we've had people that have been frontline caregivers, people that have impacted personally within their family, and we know that's had a big impact. We also know in one of the waves is what happens to all the care that didn't took place, the immunizations that were not given, the chronic care management that didn't take place. And so we're also working with our clients to try to assess what those impacts were and how we as an information systems organization and how our clients themselves can make sure that they're attending to the needs of all the patients and citizens in their market. Well, the next phase, next point I wanted to make is that we really took a three-phased approach, and we're in the middle of that second phase. So first was the immediate need to respond. What resources could we bring to bear so that our clients using information technology and our resources as an IT infrastructure company, how could we help them very quickly respond to the immediate needs? And there were lots of examples of things like setting up tents, drive-by testing, many things you've seen in your communities. Well, all of that, as you know, took IT infrastructure, and teams worked tirelessly through nights and weekends to make sure that that was a non-disruptive service offering from healthcare organizations around the country, and really, really great outcomes by all vendors, suppliers, and obviously healthcare organizations and their teams. As we shifted into that second wave that we talked about a moment ago, what you now begin to see is how do I recover? I had so much lost business. Clients 10, 20, 30, 40, 50, $100 million losses coming out of those first couple, 3 months. And now we're solidly in the middle of the June. Can we recover? Can we recoup lost revenue? How much money do we get back from federal and state stimulus programs? And it turns out while those have been great, we're still seeing gaps across the industry in our clients' ability to get back to some operating normal from a financial perspective. And then if we're good strategic thinkers, if we learn from this pandemic, what are the things that we would reimagine for healthcare? What are the things that are durable? What were the changes in telemedicine? What were the changes in work from home? What were the changes in treatment protocols? How would those things begin to change fundamentally how we look at healthcare in the long run? So first, as I talked about, was an understanding of how the environment had changed. Secondly, to then design our strategies around, first off, to respond, to recover, and then to help our clients reimagine healthcare. The next slide really talks about the response that we had internally. And I would, this is where Bill Graff and our CIO and the various teams that supported Bill really stepped up and to put in place in a very short period of time for 27,000 plus associates to go completely to a work from home and to transition all of our support, our infrastructure, with few exceptions, all being able to be deployed at home. Now that doesn't happen overnight. That doesn't happen because, the pandemic occurred. It took lots of preparation, lots of planning that had been going on for years around business continuity, and really proud to see the work of that team. Our CIO, Bill, had talked about this concept of borderless mobility, which is any device, any location, infrastructure that enables our entrepreneurial spirit, encourages innovation, that security was part of the, well, look, all that came to play when it was time to send everybody to work from home. And I say, unlike some organizations I know that had some challenges in the transition, I have to tell you, we did not skip a beat. I'm so proud of the Cerner associates and the team that pulled this off. Now, we were fortunate. We had made a transition to Office 365. We had made a transition last August to Teams, and to have an integrated platform allowed us to be incredibly agile in this movement to work from home, and to have an integrated, again, platform, I think really made the difference. And I hope the technology that you saw put in place to support you and your organizations was similarly positioned, and you had a great experience as well, but it really was a game changer for us and really made things great. The other thing that we learned really that our clients were demanding similar kind of agility and response. One of the things that we had to come up with, healthcare we're part of the national, essential infrastructure. And our clients were depending on us to keep systems running, to harden the core systems, to limit our change management, to limit any opportunity that we would have possibly to have a system failure or a system outage. So we put in place some kind of hyper oversight to make sure that that didn't happen. And then we turned our attention to really understand the rapid turnaround for the request the client made and the analytics and the support that went with it. So I'd say overall a really, really good early response from our infrastructure team, both supporting Cerner as a company and the Cerner in its managed services role with clients. The next slide I wanted to talk about is kind of clinical impact in practice. So if you're going to be meaningful in supporting your clients and as a healthcare technology company, it's really about getting inside what the clients were facing as their immediate needs and trying to remove all the noise that was not really top of mind for those organizations. So we quickly activated kind of a learning community within our clients. We turned our attention to creating response guides to deal with the nuts and bolts, the nitty gritty of what it takes to actually implement these new locations, whether those be in convention centers, tents outside, reactivating floors, changing floors. And I know to some degree it's like, wow, what's the big deal? Well, the big deal is that takes work in both physically setting up and provisioning those locations, from networking, whether it's wired or wireless, and all of the hardening capability to keep those up and running 24/7. It also means building new locations, new providers, new procedures, new tests. And all of that was done in a relatively short period of time. And we put together these guides that we said to help deal with the surge and to deal with potentially the disaster recovery about keeping those up and running. We had to build field hospitals quickly with our clients. Nightingale in London, you hear the, in Spain, and in cities and towns across America to assist clients in doing it. We also recognized that this was an incredible financial burden. So to the degree that we did those temporary expansions and create additional capacity, we in fact did those things mostly at no charge. There were some fee-based things that we had to ask our clients to share the cost in. But we viewed much of that increase as temporary, and I think we treated our clients fairly, and they've appreciated that and treated us well along the way. We also tried to do, and look, on the next slide talks about Response Center. What we tried to do there was to say, hey, if we're learning these things and we've created client collaboration, you got to put it face up. You got to make it easy to find. So we retooled our Cerner.com experience, and we moved as much of the content, as much of those guides, as much of the learning face up, no password. Anybody could get to them that would describe our response and the work we did. And I'm really proud of our team on the marketing and the communication side for one, quickly implementing, testing, getting that stuff out the door, and then monitoring activity and usage to say, did it matter? Are people actually looking? So again, you had stuff that they would use, their clients would use. We also wanted the safe space for collaboration. So we did maintain on our historic kind of, they're not behind a firewall per se, but they're password protected. So the clients will also continue to have a safe space to collaborate. Now, as clients were coming out of Respond, and again, we have some clients that are still right in the thick of things in different parts of the country, but people have increasingly turned their attention to recovery, and there continue to be challenges in getting procedures rescheduled, looking at those things that were considered non-essential, but we all recognize were probably pretty important to get done. So there's been a rush to get those surgeries rescheduled. At the same time, as we learned in the Respond, we had to activate things like telemedicine, telehealth, virtual waiting rooms, connections to spare the amount of time a caregiver would have to go into a room. So we had IV poles with iPads on them. We used Ring doorbells. We used all kinds of different technology, kind of the Rube Goldberg, and really learned that's where innovation and agility mattered. So it wasn't just putting the technology, but it was also getting it connected and getting it integrated. And we see that same kind of thing in recovery. How do you make citizens, how do you make patients, families, how do you make it comfortable for them to come back into the hospital? Hospitals is probably as clean as they've ever been. And then universal precautions are in place. And so, we all should feel good about returning to doctors' offices and hospitals and the precautions they put in place. But it's still a matter of telling that story, if you will, and selling it a little bit, of getting people to come back. So we have clients today that are trying to get back to that 80%, but they want to maintain some capacity in case this thing surges again. Because what we've learned about these surges is they happen very quickly. They go from 5 patients to 65. They go from 10 to 150. And we've seen that as a very common occurrence. So lots of our organizations are, while they're aggressively trying to get back the volume, trying to get people back in the clinics and EDs as appropriate, they're also finding that they have to maintain some capacity for what might be the next surge. So the final piece that we think about is, how do you reimagine healthcare? So what are the things at a policy level, at a reimbursement level, that actually will outlast the pandemic? Again, if our job is to serve clients, well, we aren't getting stimulus money from the CARES Act. Our clients are. How do we help them to secure the most amount of money going forward? How do we advocate at the policy level? How do we advocate at the regulatory level for the durability of those key changes in telemedicine, those key changes in reimbursement and credentialing, things that have really allowed our hospital-based organizations and physician organizations to be agile and responsive? And so I think really what's so important about the work of this institute is it's just that. It's that agility is not just about a design and development framework. It's about organizations being able to respond and innovate the needs of their clients while maintaining, obviously, the organizational objectives and outlook that all of us need to have as good stewards of our corporations, our organizations, and good stewards of the interests of our client. So we've thought a lot about, in reimagining healthcare, what are the things that last and what are the things that need to stay? And candidly, the 3 things that have surfaced time and time again is making the telehealth, teleconsult, tele-everything, e-hospital, make that real, make it something that will last, and that's kind of job one. Second is to rethink the way we do consumer engagement. And finally, the areas, the importance of reporting and analytics at every single turn. So that's really the path we've been on to help our clients to respond, to recover, and reimagine. The final thought I would just say in the next couple of minutes is we also have a role as a task force to inform senior leadership. And we have to move from what I would call the headlines really into the insights and action. So one of the things that we did is to say, what's the plan? What's the shape of that recovery? You hear a lot about the shape of that recovery, but the role that we have played, and I assume someone has been playing in your organization, is you're taking the macroeconomic indicators, the disease, progression of the disease throughout a country or a market that you're in. We look at the client indicators, we're looking at our company indicators, and then we're calibrating that with outside forces. And we're really trying to decide that shape of the recovery. And so we've put together, I'll highlight one piece, and this comes from a large group of clients that report data to us on a regular basis. How have they done? And as you can see in the shape of the slide that looks at the change in surgeries from the baseline, that it's clearly a U-shaped recovery. The clients are coming back. Now, will they come back at the same rate? Will they fill up at historic levels? That remains to be seen. But I think we've got some really great indications based on surgical cases, inpatient visits, outpatient visits, and laboratory procedures as they approach the baseline. So, on the path to a vaccine, a final thought for those of you that are tracking this from home, which is we are a long way away from herd immunity. So, the most optimistic case is first dose might be available for healthcare workers in the fall, maybe October, November, if everything goes well. And the ability to have mass immunizations and vaccinations is probably sometime in 2021. But as you can see on this final slide, the world's still a ways away from herd immunity. So social distancing, wearing masks, contact tracing, all those things continue to be important, and they continue to have an information systems component. So with that, I'll conclude my remarks. I want to thank you again for the opportunity and be happy to take some questions here